non-attendees will be considered for other members. Joining me live now is Fiona Martin. She's the chair of the Select Committee on Mental Health and Suicide Prevention. Fiona, thanks so much for your time. You're also the member for Reid, so we appreciate your time. We're all in lockdown this morning. Laura. First of all, I want to talk about really a bit of a legacy from Brittany Higgins. This real compliance, I guess, will not cover, when she was in Parliament and working in Parliament, but it does mean that parliamentarians will be held to a higher standard. Does it go far enough?
Yeah, look, I'm very happy to hear that the Prime Minister has taken on board all 10 recommendations put forward by Stephanie Foster's report. It's incredibly important for women to feel safe in the workplace and particularly in our nation's capital. And all of these recommendations are going to be taken on board. I'm particularly happy about the independent reporting, but also the training that will be available for parliamentarians and senators. I do feel that the training should be compulsory and there should be a register for all members of Parliament to ensure that this training is conducted. And I know that students at universities have to complete this kind of training when they enrol for a university degree. And in most companies around the world, this sort of training is provided to ensure that women are safe in the workplace.
Yeah, look, at the moment, not only is that the important issue, particularly in Parliament, but, it has knock-on effects for the entire country. But on the lockdown, we have the Crisis Cabinet in New South Wales considering really a tiered system of lockdown. Those areas which have hotspots and greater number of cases keep contained and maybe allow more freedoms for other suburbs. From a mental health aspect, would you support that?
Firstly, can I just say how incredibly courageous and brave and proud I am of all Australians who are getting tested, getting vaccinated right now. It's incredibly important that we all work together because we can only get out of this together. And particularly for people in Greater Sydney right now, we need you to get vaccinated as soon as possible. And with the changes in the advice from ATAGI, anyone over 18 should consult their GP and consider AstraZeneca right now. In terms of, LGA to LGA, that is a matter for the New South Wales government. It has always been a very, very difficult balance between the health risk associated with the pandemic, but also the economic impact that that's had. And of course, in talking about the health risk, we're also including the impact that it's having on the mental health of all Australians. I know that people are anxious, are stressed right now, not just anxious about actually getting the virus themselves, but protecting their family. They're also anxious and stressed about not being able to see family. Many of my constituents in Reid are separated from family members right now, and it's an incredibly difficult time for them. So it's very important that we draw on whatever resources we have during lockdown to protect and look after our mental health. And those sorts of things include keeping to a routine, ensuring that you have a regular sleep pattern and exercising, because that's within the health orders and you should most definitely be doing that.
Well said, to remind people that you can exercise, and that is such an important part of maintaining your mental health. I asked the Prime Minister about the suicide rate in Australia over the last 18 months last week, and he points to the statistics that haven't really changed on a level. But I feel like at the moment, Fiona, everyone is just, a couple of degrees away of hearing of a tragic story, or of hearing those anecdotes of a family going through a really tough time because someone close to them has died by suicide. And, Dita Brummer was 45 years old. He died yesterday, and that news would have shaken a lot of people up.
It's tragic when we lose somebody close to us who dies by suicide. And, the Morrison government is committed to zero suicides. That is what we're working on. And that is why this committee was set up. We know the landscape around mental health has changed since the bushfires and particularly since the pandemic. We're focused on addressing what's going on right now while people are in lockdown. And we're hearing from a range of different community organisations, grassroots, right through to the big mental health organisations, to ensure that we put in place everything that we can to help support people. And, you know, if anyone is out there needing assistance right now, they should contact Lifeline, Beyond Blue, or Head to Health and Headspace, because there are many organisations out there that are ready to help.
Yeah. Fiona, just one final question. There still seems to be a disconnect, I feel, when you look at public policy, that mental health is seen as something that is treated in a silo, but we all know the things that contribute to that. Isolation, financial stress being two of them. And those are things that are being experienced right now for people in lockdown. And that doesn't seem a metric that officials do take into account when they're locking down and putting curfews on and imposing restrictions and not coming forward with adequate financial support. What's your take?
Well, we're spending a significant amount of money on mental health. We've boosted our crisis support lines significantly during this period, and that's helped us be able to take on more calls and support more people across the country, particularly in New South Wales, at this very vulnerable time. I think it's very important for individuals to do whatever they can to look after themselves. So if that's picking up the telephone or getting online and asking for help, be that. But as I said earlier, routine is very important while people are in lockdown. Sleep is number one when it comes to mental health, and I can't tell people how important it is to activate, to get out there and to exercise during this period, because that is what will help you get through day by day.
Okay, Fiona Martin, thanks so much for your time. Appreciate it.